muscles is very strong. There's something called the natural expulsive response, which means that the uterus is contracting and pushing with the uterine muscles themselves, pushing the baby out.
And they are a barrel shape, which is a strong shape.
That's right.
Yes.
And women in comas can have babies.
Vaginally.
So a woman in a coma is unconscious. She can't move a muscle.
She's not bearing down.
Right. And so it's the force of the uterus that is pushing the baby out with the natural expulsive response. Women have no control over this. The uterus is an involuntary muscle.
Is that really true? I mean, because when you talk about it, so is hypnosis trying to let your body get out of the way?
Exactly.
Get your mind out of the way. Get that fear out of the way, which holds you back.
Something you wrote about Braden was trying to remind yourself not to curl your toes. Was that because you were expending energy in a muscular activity that was unnecessary? What was that about?
Well, think about when you curl your toes. It's when
I'm
you
curling
curl
them right
anything,
now.
It's fear. You're afraid of something. It's that
You're tensing up.
You're tensing up, and when you're birthing a baby, you need to be relaxed. You need to be all loosey-goosey from head to toe.
I imagine that. Can you physically stop yourself from having a baby? I mean,
Not well physically.
I'm one shaking the head yes, one shaking the head no.
Multiple reasons.
Right.
Yeah,
Right.
you can actually stop labor out of fear. So a mom holding on to fear mentally, emotionally.
Is it
even
tensing up
physically,
the outside walls of muscles that are not
that,
the uterus?
as well as a mental determination. Tammi can speak to this more because she's actually seen it, but there is a holding back with some women out of fear, and so it really does take letting go. That's another part of the preparation of allowing birth to run its course. So maybe Tammi can talk more about that.
And I see this a lot less in my practice because so many of my moms either do hypnobirthing or have studied it and are going into birth knowing about relaxation and knowing about letting go and releasing and allowing. And I also talk about this prenatally. So I see a lot less of that, but you know, if a woman, there are women who, if they know, if they're birthing in the hospital and if they know that Dr. X is on call, they will turn their labor off like that. And then when Dr. Y comes on, they go back into labor and have their baby. The mind is so powerful. And that's why we need them to release, even before birth. We need them to be doing their work before birth about letting go and releasing. And when you're with a care provider that you trust, you don't have to do a whole lot of work. But when you're with a care provider who you're not sure if you're going to end up with a cesarean or all kinds of interventions, you're holding on.
Because it sounds like there are 2 points of view in this. Well, you're thinking point of view of the we're going to do it for, but I'm thinking in a sense you can almost view it's your job and you're welcome to have a team with you. That's sort of the 2 ways of doing it. Say it's my job, but I can also have a team.
Well, yeah, it's really nice for women to have support if that's what they want. Now, there is something called unassisted childbirth. Those women feel empowered and choose to be alone for birth, and I'm not talking about them because that's their choice. But for other women who are going to give birth, it is really nice to have the support of comforting caregivers around them, at least one other female.
Now, isn't it, this is more about birthing, I guess maybe one other female as well. I mean, you know, we're taught to hide our private parts through our life. I mean, and, you know, everything's going to be hanging out. I mean, everything from going to the bathroom to giving the birth of the baby is going to happen right there and then, I would think. So that's like, I mean, there are no secrets.
That's right, yeah.
I mean, that's, to me, an amazing thing to have strangers running in and out of the room in itself.
Right, and at home you don't have strangers. You know, you have, you know, if you have a midwife, sure, she has probably not seen all of your body parts before, but you've developed a relationship over pregnancy. You don't have these 15-minute in and out appointments, prenatal appointments. You have like 45-minute to an hour appointments, so you really know each other. And yes, there are some women, especially, you know, that have more cultural tendencies to modesty, and so they will be more covered until right before the time of birth, and that's honored too. And they know that with a midwife, that will be honored. You know, you're not going to be told to get in a gown.
And you've had Muslim clients, I
sure.
remember, right?
Mhm.
So, Stephanie, do you ever go to the births yourself?
No, that's not part of the hypnobirthing practitioner's role.
Mm-hmm. Other than your own birth, of course, but
Right. And my birth was actually a lot like Tammy's. Mine was at a birth center, at Birth Care in Alexandria. So it was very much like a home birth. There was no difference other than I went there, but all there is a bed in a room that looks like a bedroom. So,
well, that was how natural we got with ours. We were in a room that had oak paneling
nice.
and a bed. Well, it was in a hospital. It was in Women's Columbia's Hospital for Women, which has since closed down, but I always felt it's nicer than white painted walls and things like that. But I still felt it was, in retrospect, in fact, I said to my wife, Toby, just tonight, said, dear, what do you think it would have been like had we met these two, you know, in 1989, the year before we had our kid? Because she, you know, my wife always talked about, you know, I'd like to stand up. I'd like to be on my feet as long as I can, you know, before I get my epidural. And I just, you know, you talk about empowering, people just need to know. I mean, as a contractor, I do this all the time. I look at people and say, you can put a hole through a wall.
Right.
You know, I mean,
Exactly.
I move walls. You can do that. It's allowed. You know, and
it's possible.
And in a sense, what you're doing with a lot of women, I guess, is you're saying you can do this. I mean, I mean, do you have to look at people and say, Stephanie, you, this will be your, you know, unless something very unusual happens, this will be all the medicine you need.
Yes. And the thing, though, is that a lot of the women who come to hypnobirthing classes know that on some level, but yes,
They're self-selected.
right. But they still have some fear and anxiety. So yes, by talking to them about how natural and normal birth is, it is reassuring to them and empowering to them to know that yes, they can do this, and they can do this on their own.
So this is the radio hotline with Dennis Price, and you can reach us at 560-703-560-8255. I'm here talking with Tammi McKinley, licensed midwife, and Stephanie Kraft, MS Healing and Hypnotherapy. Is that how you introduce yourself? Usually, your official title?
Oh, I just say Stephanie Kraft.
Okay. Okay. Now, do you two work together sometimes, or? Oh, we're getting a call.
Oh, yay.
Let's see if I can get it on the air. We'll need the headphones. Hello? Hello? Yes, this is WEVR Radio Hotline. Did you want to talk to one of our guests about birthing? All right, well, if I lose you, call back, but I'm going to try and put you on the air, getting my headphones on, and we'll just see what happens. I'm always one finger away from perfection. Let's see if we can do it. Caller, can you hear me? Hello, let's see. Caller, can you hear me?
I can hear you.
Ah, all right. I can hear you too, so I've done it. Hi, do you have a question for Tammi or Stephanie?
I'm just wondering how you feel about twin home births.
Oh boy, everybody's laughing and smiling at this. Tammi? Anyway, yeah.
I think it's just fine. You know, depending on the pregnancy itself. I wouldn't rule them out just because they're twins.
Are you planning on having twins?
No, I hope not.
Are you currently pregnant yourself?
No, we're trying to get pregnant.
I see. Well, that could mean you could end up having twins. You never know. So, have you decided how you're planning on giving birth at this point?
We would definitely have a baby at home.
Wow. And is this your first?
No, it would be our 7th.
Excuse me?
Yeah.
Your 7th?
It would be our 7th baby.
As in like the number 7, like 1, 2, 3, 4, 5, 6, 7? Oh my goodness. And wow, I don't meet many people who've had 7